Greetings and welcome to another edition of Montpelier Connection. I'm State Representative Mike Mrowicki from the Windham 4 District of Putney, Westminster, and Dummerston. Today we have another show on health care, but this is not a show about insurance. Most of the conversation around health care has been focusing on insurance, but what I'd like to do is broaden that discussion to talk about real care, how we take care of each other, how people help us be more healthy. Today's guest is Dr. Samantha Eagle of Brattleboro. Welcome, Doctor.
Thank you, Mike.
And can I call you Samantha?
Please
do you want to be called Doctor?
No, Samantha's just fine.
Great. Dr. Eagle, and I'll start with that, is a practitioner, a naturopath here in Brattleboro. She is part of a growing practice that we're seeing all around Vermont of people who'd like their health care to come in a different way. People who want to be a bigger part of healthcare, who do not necessarily abide by simply traditional allopathic care, but sort of like what Dr. Andrew Weil has been pushing forward around the country in looking at integrative medicine, different ways of staying healthy, maintaining health, or regaining health, and outside the realm of just pharmaceuticals or surgeries. There are many different practitioners in Vermont, and especially here in Brattleboro. Tell us a little bit about how you got into being a healthcare practitioner and what your practice looks like now.
Sure, thanks. So I just actually want to back up a little bit and talk about how I came to Brattleboro, because that actually plays a significant role in how I decided to become a naturopathic physician. I grew up on Long Island. My father's a physician and have a mother who has a background in science, and unfortunately became ill as a young child, when I was a young child. I was lucky enough to attend the Putney School, and that was my first introduction actually into the realm of herbology and nutrition. Had a great experience at Putney, went on to University of Vermont, and had always thought that I was going to go into medicine. It wasn't until a little further into my education that I became very interested in people and counseling people, and really getting to the more mental, emotional piece of illness. Years later, after contemplating graduate school and what I wanted to do, I ended up realizing that I can incorporate my counseling skills into a medical practice. I had to go back to school and do a post-bachelor's pre-medical program, which the pre-medical curriculum is required for naturopathic physicians. And did that, and during that time really formulated my views of medicine and the practitioner that I wanted to be. So that was the entrance into my career. I went to University of Bridgeport, College of Naturopathic Medicine in Bridgeport, Connecticut. At the time, it was the only naturopathic medical school on the East Coast, and I was one of the very early students there. And graduated about 7 years ago and came back to Vermont to open my practice.
Now, is that when you started the current practice you have now, where you have a number of different practitioners working together?
Correct. Yeah. I started Biologic Integrative Healthcare. It was just me. I had a small waiting room and one treatment room, and had always planned on expanding my practice. Integration to me means gathering the best evidence-based modalities of all of the different practitioners out there and providing that service under one roof.
What other kinds of practitioners work together with you at Biologic?
Sure. So we have Dr. Cheryl Proctor, who's another naturopathic physician and provides acupuncture services as well. Dr. Liz Kaltman, she just joined us. She relocated to this area from Portland, Oregon, and she's a naturopath who's providing gynecological care. Dr. Louis Melmadrona, who is a medical doctor and psychiatrist, as well as Dr. Liddy, a chiropractor, and we have a bunch of other allied health professionals assisting us. So lifestyle educators, integrative yoga therapists, and we will be adding more as time goes on.
So what is it about naturopathy that expands how traditional allopathic medicine looks at health?
Sure. Naturopathic medicine has a core group of principles in which we address each patient. And the first one, which is the same as allopathic medicine, is first do no harm. Our take on harm is a little bit different. We look to use the least toxic treatment modality as the first line defense. We also believe in addressing the whole person, not just the symptoms, but the entire individual. And the statement that I usually make about that is just because someone has a headache doesn't mean they have an aspirin deficiency. So if someone is getting persistent headaches, yes, aspirin will cover up the symptom. However, we have to really address why that individual is continually getting those headaches. It may be because of dehydration or a food sensitivity or food allergy. It could be stress. It could be musculoskeletal. It could be a brain tumor. We need to address the root cause and not just cover up that symptom. Naturopaths also strive for prevention, and prevention is a very interesting term. I think we'll talk a lot more about prevention later as to how it pertains to healthcare in Vermont, but prevention is key. Also, we take the role of doctor as teacher very seriously. Patients come to us looking for advice, but also really needing to understand what's happening so that they can make informed decisions about their health care. And we believe in wellness, so not just going to the doctor when you're sick, but also going in a state of wellness to optimize that state. So that's one of the main differences is our philosophy around healthcare. We generally spend much more time with our patients. We're treating the whole person. So yes, you might be going in for a headache, but we're going to spend time talking about everything.
Well, what does it look like on an initial visit to you?
Well, we have a standard medical intake form. Again, we want to know what was the driving factor for a person to come into our office, but we're not just going to focus on that. Certainly, we need to find out about family history, personal history, things like how they're sleeping, what their stress levels are, and then certainly going through their entire system. So we are looking for the common threads. Again, it's not just focusing on the specific symptom, but getting a much greater picture of that individual.
So when you take that history and you look at the basics that somebody presents, what are you seeing in the general population that you feel like we need to be addressing? Like we had a show earlier in this year with Dr. Bookwalter talking about obesity. And one of the reasons we did this is because I think Dr. Bookwalter is looking outside the box.
Absolutely.
In terms of how we look at obesity, how we look at diet, and looking at a lot of the newer research that statin drugs are not really working, that dieting is, the way most Americans look at it, is pretty much a useless endeavor unless people are ready to make lifestyle changes, that the 6-month diet is not going to do it just to lose weight, and that diet is, I think what you're saying is about how we eat all the time.
Correct.
Yeah.
I should say that biologic integrative healthcare really focuses on lifestyle medicine. So to me, there is no pill that will take away bad eating habits and lack of activity and deferred stress management. So, of course, as a naturopathic physician and someone who has a background in nutrition, nutrition is paramount. We need to make sure that the individual is getting all of the basic nutrients for them to have healthy biochemical pathways. the conversation about obesity is a very important one to have. We all know that we in this country and this state are in a healthcare crisis. And to me, that crisis has evolved because of what we're putting into our bodies. There is no amount of medication, there is no amount of surgery that will solve this problem. People have to start having real conversations about this crisis and how we got here. Yeah. And that is one of our main approaches at Biologic. We have to understand, what is the person ingesting. If a person is ingesting foods that are not optimal and not providing the basic nutrients that their body needs to make proper neurotransmitters. Neurotransmitters are things like serotonin, norepinephrine, that keep our brains happy and healthy. Those need amino acids. Amino acids come from proteins. If people are not getting adequate amounts of proteins, if they're not getting the cofactors in terms of B vitamins from their food, then they're not, how can we anticipate that they are going to be producing a healthy balance of neurotransmitters? And that goes for every single enzymatic reaction in our body. So nutrition is at the foundation. And when I speak of foundation, that is an analogy that I use quite frequently. People come in with a symptom, and that symptom generally is not something foundational. It's something that's up in the structure of the building. And so we often have to kind of strip away the structure to find out where is the crack in the foundation. And nutrition does that. Talking about activity level does that. We start dealing with the foundations of health.
Yeah. In your training, is nutrition a part of?
Nutrition is a huge part of it, and that is one of the differences between the more traditional or allopathic trainings versus naturopathic trainings. I have 2 years of the basic sciences, anatomy, physiology, biochemistry, pathology, all of those ologies. When we get to the clinical sciences, that's where it differs a little bit. Naturopathic physicians do have a full year of pharmacology. Oh. We also have a full year of nutrition. And more importantly, it's not just nutrition of what you eat, but it's about the biochemistry of nutrition. And that is very different from most traditional medical schools, where they have about 3 hours of nutrition classes within another class. And as many of my friends have said who've gone the more traditional route, they usually skip that class or just assume that they knew everything that they needed to know.
Yeah. And what you're saying is that our basic body chemistry is it's impossible to separate what we eat from our health and our general being.
Correct.
Yeah. So now you have a practice here, and you talked about the nutritional aspect of it. What about activity? And what you mentioned before, I think, was a term called lifestyle medicine.
Lifestyle medicine encompasses 3 areas. One is nutrition. In our practice, we adhere to providing information to our patients about a low glycemic, modified Mediterranean diet.
What is the Mediterranean diet for people who don't have that experience yet?
A Mediterranean diet focuses on leaner proteins, not all vegetable-based proteins, by the way. People have a misconception that as naturopaths we don't believe in any animal consumption. That's not true, although there are different philosophies within the naturopathic community, just as there are within any medical community. Eating lower amounts of grains, so minimizing the amount of simple carbohydrates in the diet.
And are these simple refined grains, or
refined
or whole grains?
Refined, limiting the amount of refined grains and eating smaller quantities of whole grains. Yeah. Lots of vegetables, and not just the more starchy vegetables. So eating dark leafy greens, things that are readily available in our community through local farmers. and having a good source of fats, the fats that are anti-inflammatory.
The omega-3s rather than omega-6s?
Correct.
Yeah.
Yeah.
So which are those?
The omega-3 fatty acids, I'm going to give a little bit of a biochemistry lesson here. There are a bunch of different plant-based omega-3 fatty acids that need to be converted in our bodies into the more active constituents, which are EPA and DHA. The plant-based omega-3 fatty acids include flaxseed oil, borage oil, walnut oil, olive oil. But again, those do need to be converted in our body into EPA and DHA. Fish oil is an example of a omega-3 fatty acid that is already bioactive. So when we take in a fish oil that already has the anti-inflammatory properties, anticoagulant properties of the omega-3 fatty acids.
Now, does that suggest that some people, for instance with flax oil, might not process that as well and not get the benefits out of it that they might if they took the fish oil?
Yes, it's one of the issues. We don't necessarily understand why this is happening, but more and more people are deficient in one of the rate-limiting enzymes, something called delta-6 desaturase, that actually converts flaxseed oil into the active constituents, EPA and then DHA. There are also numerous other cofactors that are needed, things like magnesium, zinc, B6, B12, folic acid, which unfortunately are increasingly depleted in people's diets. This issue has been addressed by food scientists. One of the possible reasons for this is that a lot of conventional food, the soils have been over-farmed. So the actual food sources that people used to get these nutrients are depleted. When we look at the difference between grain-fed beef and grass-fed beef, well, I ask people, what happens if you were to just sit and eat corn all day long? Well, people can imagine that that's a fatty source of food and perhaps not the best source for their bodies versus eating something dark and leafy and green all day. So we've actually changed the way, with the industrialization of our food sources, we've changed the nutrients that our food has. So when we talk about nutrition, it's not just the macronutrients, eat protein, fat, and carbohydrates, but we get into more about sourcing of those foods as well, getting locally raised grass-fed beef versus industrially raised corn-fed or grain-fed beef, getting locally raised produce. Yeah,
which ties in very nicely with what we're trying to do here in Vermont with the localvore movement, eat local, local food, farm to plate. The closer to the source of your food, we think the better it is.
Yep.
Concurrently, it also lightens the carbon footprint of the food we're eating, so there's a lot of benefits to that, and it keeps our local economy going too.
Well, my favorite quote, and this you just reminded me of this, is the John Muir quote, when you pick out something by itself, you find it hitched to everything else in the universe. Yeah. We cannot look at the healthcare crisis and just see it as a problem with numbers. We have to go back to how we got into this crisis, and this is the naturopathic perspective, the more holistic perspective of looking at the whole system. Things started to change in our society as we changed the way in which we produced our foods and the way in which people had access to those foods. And we can't discount that as a solution to the problem. As we talk about healthcare reform in this state, we are in a phenomenal position to make changes for Vermonters just by supporting local agriculture.
Yeah. And one of the reasons I wanted to have you here as a guest is that, as I said earlier, we're talking a lot about healthcare reform, and really what that is, for the most part, we're talking about insurance reform. We're talking about the costs of it, which are vital. It's a big piece of it. But the reality is that I think if we continue the way we are, just doing, the health outcomes are not going to get better. If we have a philosophy as a culture of let's wait till we get sick and then go to the doctor and say, heal me.
Right.
We're not going to move forward on this. And I believe there are a lot of different practitioners in Vermont who I think would do well to be brought into the picture, to share their voices and not think of this one size fits all. So I appreciate the perspective you're bringing, especially when you frame it in terms of lifestyle medicine. Now, from nutrition, let's move to activity. What's the role of activity in people's health? And not just kids, but everybody.
Yeah, there's no debate that activity is very important. It is a balance between our energy in terms of calories and energy expenditure out. And as a society, we have become increasingly more sedentary. And the level of activity, the perceived level of activity that people have about their day-to-day is far off from what they're actually using energy-wise. People are exhausted, and people are mistaking that exhaustion, that mental, that psychological exhaustion for true physical exhaustion. And one of the interesting things that I have actually incorporated into the practice is the use of a kinetic activity monitor. And a kinetic activity monitor is a tool for people to start understanding their own body. And the CAM is a small device that the individual wears, and it monitors based on their body mass how much energy they are expending. So it's a little bit different than a pedometer, in that a pedometer can't pick up the difference between a slow stroll and a fast walk, and yet we both know that there is a big difference between that. And we are using this tool to help our patients actually get an accurate assessment of what their body is doing. And each CAM point on this small device represents 1% of that individual's basal metabolic rate. So your basal metabolic rate is the amount of energy that you expend at rest, just breathing, just your heart beating. It's not thinking, watching TV, because believe it or not, that actually does increase your basal metabolic rate. And we need to be able to set realistic guidelines for people based on their body mass as to how much energy they're actually expending, so that we can calculate how much food they need to be taking in. So activity is absolutely key when it comes to obesity or just being overweight. And we also see patients in our practice who are a normal weight but still over fat. So that's a tricky one for people to understand, that you can be absolutely fine on all of the charts, but if you have decreased muscle mass on your body, or something called sarcopenia, your body does not burn calories as effectively, and you are still at greater risk of developing some type of lifestyle-related disease. So we address those individuals who are just deconditioned, who haven't been getting enough activity. It's not about going to the gym. Yes, I love it when patients go to the gym. I enjoy going to the gym, but it's not just about that, because that's not always sustainable for people and their schedules. This has to be about moving your body, parking further away, using alternative modes of transportation, just getting up and moving throughout the day. And I will say that I have had those days where I wake up, I get my kids off to school, I run to the office, I'm up and down from my desk to the front reception area 20, 30 times. I might go for a walk during my lunch break. I get back home, get the kids, get dinner ready, do the groceries, whatever it is, and I sit down, and believe it or not, I've barely moved that day. I've barely gotten my heart rate up to a point where I am getting those cardiovascular benefits. So it's very sobering to realize what we have to do as an individual to get the activity that our body needs.
What are the benchmarks for activity? I mean, some people say 3 times a week, 20 minutes a day. Is there a level of activity and a rate of activity, getting your heartbeat up, that you suggest people need for optimal health?
There are plenty of studies that show that there are specific heart rates that provide more optimal cardiovascular health or fat burning. There are certainly times, but to me it's really about the individual and assessing that person. If I have an individual that's coming into my office that is 350 pounds, their basal metabolic rate, the amount of activity that they need to get to that fat burning, is going to be very, very different than the older woman who perhaps is underweight but still over fat. So I would love to say, yes, here's the cookie cutter, but I can't say that because we need to look at the individual. Obviously, any amount of movement that our bodies, any amount of movement that we can increase for our bodies, there's going to be health benefits. The goal is to, perhaps for most people, to get 20 to 30 minutes of exercise or activity a couple of times a day. That takes work. It takes effort to do that.
I know I have to schedule. If I don't schedule my bike ride or my time at the gym or whatever, it usually doesn't happen.
Right.
And I think that's one of the intentions I bring to my attempts at staying healthy, is that I realize I have a schedule for a lot of different things. And if I don't put activity in there, it often doesn't happen. So I think there's that kind of intention that I need to bring to it, because it is difficult to find in our schedules today. One of the things you shared with me before was when we were talking about how healthcare reform in Vermont has two primary goals. We want better outcomes and we want to reduce costs. Now, there was a tool you talked about which came out of, I think, some scrutiny that your practice was subject to through the insurance companies.
Well, for any physician, and the practitioners at Biologic are licensed and credentialed as primary care providers in the state of Vermont. We have to adhere to certain insurance guidelines, and part of that process is that the insurance companies will occasionally ask to look at the records to make sure that you are providing services within a certain scope that they feel agreeable. And so my practice was one of the first practices, naturopathic run practices in the state of Vermont, to be audited by a major insurance company. And I knew that that was certainly a possibility with becoming a credentialed provider to the payers in Vermont. And in that moment, when you get a letter from an insurance company asking for X number of patient contacts and all of the tests that were ordered and what your treatment plan was and how it was billed, a provider goes through an assessment process. And in that moment, I went from being a provider who is very much focused on my individual patients, obviously wanting to provide the best care that I can, to make my patients feel better, to have better outcomes, to realizing that I needed to make sure that I was doing this in the most cost-effective way. And fortunately, around the same time, I was introduced to a company that is based out of Texas that is a risk management company. And so the timing of this couldn't have been better, because as I sat there looking at my chart notes and what I had done for these various individuals, I became very aware of the issues around healthcare and cost efficacy. And I wanted to really begin to prove that what I was doing in my practice was not only efficacious to my patients, but also with respect to the most cost-effective way of doing it. You said something earlier that I thought was very interesting after your conversation, or during your conversation with Dr. Bookwalter. And Dr. Bookwalter certainly has been looking outside of the box when it comes to increasing healthcare expenditure. And that is that we have to start talking about healthcare costs. This is not just a conversation that should be having take place at the legislative level. The doctors have to start talking about this. Patients have to start understanding this. And the way that I look at this, and this is again after consulting with a company for a couple of years that primarily looks at large populations and that population's risk for developing some type of lifestyle-related preventable disease, is this. Almost every doctor, primary care doctor out there, has had this experience with the 40-something-year-old male being brought into our practice, usually dragged in by their wife or girlfriend, because they're concerned about something that's going on. And the individual might say, you know, well, doc, I still wear the same size pants that I wore in high school, although the belt's a little bit further underneath the belly this time around. And I'm concerned about this one issue. And the doctor says, okay, well, when was the last time you saw a doctor? Oh, I'm super healthy. I haven't been to a doctor in 10 years. All right, well, let's go ahead and do a physical and get some lab work done, and we'll see how things are going, and we'll address the concern. So that gentleman, during the office visit, it's assessed that their weight is a little bit up, but they kind of knew that, although they're sticking to their high school belt size. Their blood pressure may be slightly elevated. Okay. And the doctor sends them off to the lab to get some lab work done. And in that time, they say, come back in a couple of weeks and we'll go over all of this information. A couple of weeks pass, patient comes back in, and lo and behold, their cholesterol slightly elevated. Their levels of good cholesterol, or HDL, are low, LDL high, triglycerides, which are the fats that come about from sugar metabolism, are elevated, and blood sugar levels high. And all of a sudden, we went from this individual who was quote-unquote healthy to having high cholesterol, high triglycerides, a higher than normal fasting blood sugar level, and bordering on obesity. Now, this didn't happen overnight, but for this individual, they go home for most doctors and they say, oh my gosh, I have to change the way in which I'm doing things. The doctor told me I need to eat better and start exercising. And they try doing it. And after a couple of weeks, without much guidance, they give up. And they go for their 6-month follow-up visit just saying, well, I really tried. Let's see how these numbers are doing. And lo and behold, instead of just having metabolic syndrome or just some of the risk factors, they are now full-fledged type 2 diabetics. And with that, so most doctors are familiar with that, there's a cost associated with that. And it's not just a cost that that patient is burdening, it's a burden for the entire system. Most individuals who have health insurance provided by their employer or self-purchase, their expenditure for a year is about $2,500 if they're going to the doctor. And people say, wow, that's a lot of money, even though most people are paying about $8,000 or $9,000 per year for their health insurance. But I don't spend $2,500. Well, most of us do if you're going for a checkup, an annual physical, some preventive medicine testing, perhaps getting sick, having a couple of prescriptions in that year. It quickly adds up to $2,500. So that's for a healthy individual. In that first year of going from quote-unquote healthy over to some type of diagnosed state such as type 2 diabetes, that number not only doubles, but those numbers can actually go up to $30,000, $40,000, $50,000 in the first year of diagnosis. And that is where the problem is. The problem was that in that time period where this individual was diagnosed with metabolic syndrome or something called pre-diabetes, nothing was done. And that is where providers need to have to start focusing their energy. Because you cannot medicate your way out of poor eating habits. And for that individual at 40-something years old, just diagnosed with type 2 diabetes, that is just one issue. The comorbidities and other things that go along with that are so numerous and so cost intensive on our system. That is one of the many things that has led to this significant healthcare crisis.
Yeah. Now, when you say comorbidities, the conditions that can arise from that, and that's not just internal organs, but musculoskeletal,
Correct.
Arthritis.
Yep.
And I'm leading into inflammation.
Inflammation, okay.
and it's one of the things that there's a growing body of research about, the body's inflammation response to diet or lack of good diet, to stress. Stress is another huge one, and the other factors, overconsumption of alcohol, tobacco. Can you touch a little bit on this? Because connected to the obesity problem, I see underlying that is the body's inflammation response to these stresses.
Yes. So with regard to the most expensive things, we are looking at type 2 diabetes, cardiovascular disease, cancer, musculoskeletal issues. Those are some of the most costly issues that are facing our healthcare paradigm. And at the root of all of those is the theme of inflammation. There are things that we can do from a nutritional standpoint to decrease inflammation. Inflammation does serve a function in our body. When you get injured, there are certain processes that happen to decrease the extent of the injury. Bringing white blood cells to the area, bringing more blood flow, can all help the body heal. After a certain point, the healing can become inhibited by inflammation. We talked about omega-3 fatty acids, and one of the interesting things about omega-3 fatty acids, specifically EPA and DHA, is that they serve an anti-inflammatory effect in our body. And what that means is that the body, when inflammation has run its course, we need to stop that process and allow healing to take place and get rid of those prostaglandins and leukotrienes that are inhibiting tissue repair. So we look at a low glycemic diet. Sugar does cause inflammation in the system. And so when we talk about type 2 diabetes or any type of diabetes, the body has a very narrow window in which blood sugar should be controlled. And anything beyond that causes oxidative damage on our blood vessels and increased inflammation. When we talk about the comorbidities associated with type 2 diabetes, coronary artery disease, I remind people that you wouldn't put sugar in your gas tank. Don't put it in your tank alone, because it gunks up the works, and that gunking up of the works causes endothelial damage. The lining of the blood vessels become damaged, and there's inflammation. People are familiar with the idea of a heart attack. A heart attack just doesn't happen overnight. A heart attack has to have a certain set of conditions. And we're starting to understand that inflammation is at the core of that. When you come to a naturopathic physician, we look at the individual and the individual's risk factors. One of the things that we routinely look at, instead of just cholesterol, which we are all familiar with, is something called cardio-CRP, or C-reactive protein. This is an inflammatory marker for inflammation around the heart. And if that marker is elevated, then we know, in addition to other cofactors, that that person is at a higher risk for developing some type of cardiac event. So inflammation is key, and we're starting to understand as providers that we need to look not just at the cholesterol, but what is this individual's level of inflammation, and start managing that. It's not just managed, by the way, through medication. We have to look at where is the inflammation coming from. We do know that eating trans fats, that eating a high simple carbohydrate or refined carbohydrate diet is not optimal. We know that eating dark leafy greens, eating things that have other anti-inflammatory properties, can help modulate the body's immune response and decrease overall inflammation.
Now, getting back to how you're starting to track progress your patients have made, and how to put that into a bigger body of research, using the tool that you've you've been utilizing through the risk management company.
Correct.
Yeah. How does that work? Where you're helping to develop not just better habits for your individual clients, but you're contributing. Is that what's happening?
Correct.
To a bigger body of knowledge and research?
When it comes down to healthcare changes, it's about data. It's about data for the patient. It's about them knowing what's going on and understanding the changes that are taking place in their body to really empower that individual to make changes. We cannot make changes if we don't understand what is happening and why. And I just a little piece is I name my business Biologic, integrative healthcare that makes sense. It has to be logical. It has to be logical for the individual walking into our doors and as they're walking out, understanding what is actually taking place. So looking at tools and information. The physician also needs to have adequate data to assess whether or not the treatment programs and protocols that they're implementing are getting the desired outcomes. One of the concerns that, again, you mentioned with Dr. Bookwalter is that risk factor management and reduction does not necessarily mean risk reduction. We can sit and talk about the pros and cons of the statin medications, the medications that were developed to reduce the body's synthesis of cholesterol. Yes, those medications serve a function, but they are a Band-Aid, and that Band-Aid is causing other issues. When you don't address the underlying cause, most people don't just make too much cholesterol. That's not most people's problem. Yes, there is a portion of the population that has that variant where their body is producing too much cholesterol. Familial hypercholesterolemia is a real thing. Most people have lifestyle factors that contribute to their elevation in cholesterol. Elevation in cholesterol is not a deficiency in statin medications. For anybody out there that is taking their statin medication, it's not to say to get off of it. It serves a function right now, but it serves as a tool to provide you time to make significant lifestyle changes. We also know that with statin medications, there's an increased risk of developing type 2 diabetes, that there's an increased risk of impaired cognitive function as the individual ages. And these are not surprising. We know that these medications deplete certain things from our body, and without actually adding those things back in, there's going to be problems. So we can use these medications as a way of buying time, but that's not where everything should end. So we can lower cholesterol, but lowered cholesterol doesn't necessarily mean that you are at lower risk for developing some type of lifestyle-related disease. Again, risk factor reduction does not overall equate to risk reduction. So yes, my practice is currently using a tool called the Q-score. And the Q-score literally represents where you stand in line. If you were to take 100 individuals of the same age, race, and ethnicity and line them up, the goal is for the individual to be way in the back of the line. You don't
away from the doctor.
Away from the doctor, which is position number 1. So we want that individual to have a Q-score as close to 100 as possible. The Q-score takes into consideration certain biomarkers. So we've already talked about cholesterol, blood sugar, blood pressure, height, weight, which in turn relates to body mass index, as well as self-reported nutrition intake, self-reported activity, and self-reported stressors in the life. And it gives the individual one number. Most patients walk into a doctor's office and they just want to know, am I going to be okay? And with this tool, I'm actually able to say with a little bit more certainty, yes or no, or we have some things that we have to be concerned about. And so with the Q-score, you can take it once. The individual takes it online. It is very private. They don't need to share it with anybody. And they get their Q-score report right then and there. And then based on that Q score, we can actually make recommendations to change that Q score, to up that Q score. The Q score has been used on over 3 million individuals with corporate wellness programs. The Q score is so well correlated to an individual's risk of developing some type of lifestyle-related disease as it pertains to cost, that there are 4 life insurance companies that use this risk assessment to set the insurance premiums. So now we have a tool that ties individual risk to cost effectiveness of the protocol or of the lifestyle changes that are going to be made. It's a phenomenal tool. And again, it's not only a tool for the physician to be able to assess, but the patient can walk away with a very good understanding of where they stand in line. And we can do things with this Q score by just aging that individual 10 years. Let's say nothing changes, we'll just age you 10 years, you don't do anything different. Where are you now? And so we can empower the patient. Healthcare reform, again, the conversations are happening in the legislative sessions. They need to be happening around our dining room tables. They need to be happening on the street corners. They need to be happening in the grocery stores and everywhere that we go. Because this is about individual responsibility. We have all gotten into this problem together. We all have to work to get out of it together. We need to understand what our personal risk is and how that is plays a role in our overall population. We cannot continue to defer wellness, to defer making those lifestyle changes and expect that the healthcare expenditure is going to decrease. It's not going to happen.
We have a few minutes left, but in that time, I wonder if you could also touch on the connection between wellness, physical wellness, and mental health. The way I look at it, it's all part of the same whole, and generally we tend to separate the two. And I continue to try and work and advocate because there's still such stigma associated with recognizing mental illness, with seeking treatment. And we had Dr. Simpson from the retreat here, and he talked a lot about the connection between physical health, especially heart disease in men, and depression. Are there connections? You're talking about diet, you're talking about exercise. Are there connections between that and having a healthy mental health lifestyle?
I think there's no doubt that those are connected. We cannot disconnect the mind and the body. One of the interesting tidbits that I like to inform people of is that most people are familiar with serotonin. That is the feel-good, happy neurotransmitter. A lot of our antidepressants are actually designed around increasing serotonin in our bodies. Serotonin, the highest concentration of serotonin, is actually not in the head, where we tend to think of these mental health issues. People just go right to the head. But serotonin is actually at the highest concentration in the gastrointestinal tract, in our stomachs, in our guts, in our intestines. So there is, to me, no division between mental health and overall health. There's so much to be said about this, and we can spend definitely much more than 5 minutes talking about this.
Does what we eat affect our mental health?
It does. It does. As I mentioned earlier, when we look at the foundations of the neurotransmitters, they need amino acids. If you do not have a balanced diet, how are you getting the phenylalanine and the precursors to serotonin in order for there to be healthy balance? Dopamine, epinephrine, norepinephrine, these all require certain nutrients from our diet. There's also very strong studies that getting regular activity increases the endorphins, which has an overall calming effect and on the body, as well as a mood elevating effect. We cannot be talking about these as separate issues. We are all integrated within our own bodies, hopefully, but we have to be addressing the mind-body connection here.
Yeah. Well, I think given our time constraints, we'll have to leave it there. We could go on, and hopefully we can have another time. I think this information is essential for broadening the conversations about health, about wellness, and what we can do individually and as a state. So I appreciate what you brought here today.
It's my pleasure.
How can people get in touch with you if they want to hear more, if they want to avail themselves of your services? Is your office in Brattleboro?
Office is in Brattleboro. We are currently in the Merchants Bank building on Main Street. We have Biologic Integrative Healthcare, which is the consortium of providers. We also have the Biologic Wellness Center, which is actually on the ground floor of the Merchants Bank building. And we offer educational programs in about 600 square feet of beautiful space. And people can come over, become patients, or they can also avail themselves of our educational programs. We do have a website. It's www.biologichealthcare.com, as well as biologiccenter.com.
Well, thank you so much, Samantha.
Thank you.
I appreciate what you're doing for Brattleboro, for local people, and for the state. So. That wraps it up for another edition of Montpelier Connection. We have an election coming up. Not sure when this will air, but hopefully you people can get out and vote. And in the meantime, please feel free to connect with us. Bring us your thoughts. If you have thoughts about healthcare and where we should go, we know this is a very big conversation, and we don't think it's a time to exclude things, to think that there's a one-size-fits-all solution for moving ahead with becoming a healthier society. So please be in touch with me, be in touch with your other local representatives, and be in touch with more of your local practitioners. Until next time, this is Representative Mike Mrowicki. Thanks a lot, and thanks to the people here at BCTV for making this possible.